Hello, and welcome to today's edition of Pursuing Quality Long-Term Care, a podcast where we talk about issues of importance to residents and consumers receiving long-term care and services, and talk about those issues and some of the ways to get quality long-term care. I'm Lori Smetanka, the Executive Director of the National Consumer Voice for Quality Long-Term Care. And today we are going to be talking about the devastating effects of lockdowns on residents of long-term care facilities during COVID-19. So just about a year ago, on March 13th, 2020, the Centers for Medicare and Medicaid Services issued a lockdown order that banned everyone except essential personnel from entering nursing homes. That was as a result of COVID spreading very rapidly through nursing homes and long-term care facilities. And during that time, it meant that no family members were able to enter, no other visitors, even state surveyors who check for the quality of long-term care and long-term care ombudsmen who advocate for residents. They also were prevented from entering nursing homes for the most part during that time frame. So during that time, we at the Consumer Voice, we were very worried about what was happening within the long-term care facilities. We had been hearing stories from residents, from family members, from staff themselves, and even from ombudsmen about conditions in the nursing homes, short staff, which is normally a problem from our perspective in long-term care facilities. They don't usually have enough staff. And we were hearing exacerbated concerns about the short staffing that was occurring during COVID. So we were really worried about what was happening with residents. Many of them not only were isolated from family members, but they were having to stay in their rooms, not able to go out to the dining room, for example, for congregate meals or for activities. People were having to go in and help them with eating if they needed assistance. And with the short staffing, the lack of support that was being given from family members, again, we were really worried about what was happening. So in 2020, there was in September of 2020, there was a new set of guidance that was issued as some of the COVID infections were decreasing at that time, which permitted some very limited visits to nursing homes residents across the country. And at that point, it had been about 6 months since most family members had seen their loved ones in person. While there were some attempts to assist people to do video conferencing or phone calls, that didn't work for everyone. And so not all family members were able to stay connected or even talk to or see their loved ones during the previous 6 months. So when the visitations restrictions relaxed just very slightly, we started asking for information about what loved ones were seeing when they went back into nursing homes. When they saw their loved ones for the first time, what was their condition? What was their abilities? What did they see when they went back in? And so today, Sam Brooks, who is program manager with us here at the Consumer Voice and who led a project where we actually put out a survey to family members asking what they had been seeing in long-term care facilities. We're going to talk about the survey and the findings and then end with some recommendations on what we think should be happening to reunite residents and family members and get good care for nursing home residents. So hi, Sam, welcome.
Hi, Lori. Thanks for having me.
Glad you're here today. This was a really important project and a really important set of information that we were trying to gather during that time last fall because we were really concerned based on what we had been hearing from family members. So could you kind of set up a little bit about what some of the things were that we had been hearing and then talk about the survey?
Sure. Um, right from the get-go, I mean, we were quite concerned, as you said, because of the pre-existing short staffing issues. And as we speak with a lot of families and residents, but right away, we started to hear from family members who were quite concerned about their loved ones. They had limited abilities to communicate with them. For instance, they would use electronic communication, say an iPad. And during those visits, they were oftentimes observing loved ones who um, really had declined, either physically, they looked different physically, a lot of weight loss, or they seemed despondent, depressed, in some instances suicidal. And we were also hearing lots of stories about people being harmed,
Mhm.
people ending up in hospitals with bed sores and pressure ulcers, excuse me, and falls. And so we really expected that there was a lot of bad things going on, unfortunately. So we really wanted, once we saw families slowly, as you said, begin to meet with their loved ones, we wanted to see what they were finding. And unfortunately, as you said, it really confirmed that our survey really confirmed our worst suspicions that residents were struggling significantly in a variety of ways and continue to today. And so, although it's nice to have the report out to get it out to folks, it's also a harsh reminder of just how devastating these lockdowns have been for many, many residents.
Absolutely. Some of the stories we heard from family members really were very heartbreaking. I know, and I know you talked with a number of them, even after some of the survey results had come in. So talk a little bit about what some of the questions were that we asked in the survey. What were the things that we were looking for?
Sure. Well, I mean, we obviously wanted to gauge the most obvious things, such as physical appearance, physical decline, the demeanor of the resident, say, for instance, their mental status, which kind of we asked about whether, if folks were experiencing cognitive decline, problems with memory, or just seeming disoriented, and also, unfortunately, real depression of
Mhm.
being isolated. And so we asked questions such as, did you notice regarding physical issues, did you notice a physical decline or an improvement? Because we wanted to gauge that as well
Right, that's right.
in your loved one. And did you notice, so we asked about appearance, and we also asked about functionality for for physical abilities. And then we asked about, again, mental demeanor and how residents appeared. And then we also asked questions. We had been hearing a lot of stories about um, lost possessions, having to replace eyeglasses several times, sometimes having to replace hearing aids 3 or 4 times,
Right.
or wedding rings. And so we wanted to see what folks, if they were noticing that when they met with their loved ones. And we also wanted to gauge just what was going on in the facility. Did it seem like there was enough staff, or were staff wearing PPE? So those are really the questions we asked,
Mhm.
and that people were responding to.
Right. And PPE, for our listeners who don't know what that is
Yeah,
the
sure.
the protective gear that people can use to help, like the gowns and the masks, that gloves that they can use to help protect themselves from the virus and from the spread of infection. So, right, because the stories were telling us that significant weight loss, limited staff availability, families that weren't there to be able to help, were truly having an impact. And we wanted to know, since there were no outside eyes, I guess, in terms of what was happening in these facilities, we wanted to know exactly what was going on. So interesting questions, certainly, that were being asked. So can you talk a little bit about some of the findings, so that we started to get when the results from the surveys, the family members started responding to the survey?
Sure. We can start with some of the physical responses about physical, how their residents seem physically. And
Mhm.
overwhelmingly, unfortunately, the responses were that there had been significant decline. I mean, 85% of families who responded noticed a decline in physical abilities, and we also asked for them to describe it, and that could be, my mom or my father could get up and out of bed prior to the pandemic, and now they're confined to a wheelchair, or they need assistance even getting out of bed.
Mhm.
And 87% noticed a decline in physical appearance. And this was often weight loss, significant weight loss. We're talking about 30, 40, 50 pounds of weight loss in just a 4 or 5 month period.
Which is tremendous. I mean,
So
it's a
yeah,
tremendous weight loss in a short period of time.
yeah, it's devastating. I mean, that can have, just, fatal consequences. And, somewhat combined with that, was hygiene. How did they appear did they appear like they've been taken care of? And depressingly, overwhelming response was no. My mom or my mom or my father, it looked like their hair hadn't been washed in months. They had long nails. They weren't wearing their own clothes. They were wearing someone else's clothes. These issues that are really about treating someone as a human being.
Mhm.
Allowing them to be clean and to be taken care of. So that was really shocking to us. And unfortunately, we suspected it, but we didn't expect it to be as really as bad as we thought. I mean, one woman reported that her mother's dentures hadn't been washed in 7 months.
Right.
Teeth had turned brown. And that's just really horrific um, kind of care.
Right.
Obviously, probably abuse in many ways. So
Mhm.
um, those were really what we saw when we talked about physical decline. When it came to mental issues, again, the numbers were even higher. 9 out of 10 respondents said they saw a significant decline in their loved one's demeanor, and that ranged from anything to loved ones saying, why am I in this prison? Why have you left me here? I don't want to go on. I want to die." To just not even recognizing their loved ones anymore, sometimes seeming as if they were even medicated, and going from someone who was vibrant and engaging to someone who would not even really talk to their families. So
Mhm.
really shocking for families, and obviously terrible for residents.
Mhm.
And so, that was overwhelmingly the response. And it was just devastatingly sad when to hear that folks really felt they were being imprisoned and abandoned and were really feeling the effects of that isolation, which we all know is devastating for nursing home residents.
Right. And certainly, I think that was, something else that spurred us on with wanting to even get this information was, we knew to some extent, because there's been a lot of research and literature that has been done on the effects of isolation on people. And so knowing that that was out there and what the impact would be for the residents who um, just widespreadly across the country were experiencing this isolation was really concerning to us. So um,
Yeah.
go ahead, Sam.
And one other thing to point out, I mean, consistently since June, and we don't know before that, but we imagine it's true as well. Almost 1 out of 5 facilities have been reporting inadequate numbers of aides and nursing staff. And that means tens and tens of thousands of residents are residing in facilities that don't have the ability to take care of them.
Hmm.
So, I mean, it just seemed like inevitably we were going to see these types of decline and this type of just maltreatment. It was just inevitable, especially when we were seeing this such large numbers of facilities being short-staffed.
Right. And, to be clear about this, I mean, nursing homes are required to have enough staff to provide care for the people that are in their charge, that they are taking care of. And, when family members are in there and with their loved ones, we know that they help out a lot. I've, had loved ones that lived in nursing homes, and when I would go and visit them, I would help with some of the personal hygiene. I would help with some of the feeding that needed to take place. I would help, wheel them around and help them get them to activities and help them get dressed or changed. So there are a lot of things that families do to help support their loved one, which actually helps benefit the staff
Right,
too.
right.
So that's definitely one thing. And we really recognize that the staff were tremendously burdened during this time, where they also were dealing with the impact of COVID on their own personal lives, with needing to take care of family members and children who weren't able to go to school, or who weren't able to. There weren't daycare centers available for them, or they also had personal responsibilities. And many of them also got sick with COVID and weren't able to work. And so there are a lot of factors that have gone into the short staffing, not only through COVID, but the historical problems we've seen with staffing. And we've also recognized that that family members provide tremendous support to the residents in the long-term care facilities, and really do want to acknowledge that. I think the other thing is when we got, as we were hearing the anecdotal reports from family members, from residents themselves, from ombudsmen about what was happening, and we decided then to do the survey, we got responses to the survey from all over the country.
Yeah,
Right,
yeah.
Sam?
Yeah, that's correct. I mean, we heard really from almost every state, I think. And unfortunately, it was almost a uniform response across from people from the people responding, is that their loved ones were declining. I mean, one person we heard from was a woman named Annette Keener. Annette resides in Brooklyn, and her husband, who was named Daniel, resides in a veterans home in the Bronx, and has been there for a few years. And Annette had responded, and I was just blown away by her story, but also it just echoed really all the other stories we've been hearing. I mean, Annette, prior to the pandemic, Annette drove 2 hours each way from Brooklyn to the Bronx to spend the whole day with her husband, Daniel. Daniel is a veteran. He served for 4 years as a Marine. And during his service, he unfortunately was exposed to chemicals, which likely led to him getting Parkinson's. So Annette was involved in his care. And so we reached out to Annette, and I think we'd like to hear from her, because she's kind of emblematic of what people are experiencing.
Mhm. So, Sam, I know you have queued up some clips of your conversation with Annette recently. So can you maybe share the first clip so we can share that with
Sure,
our audience?
I'd be happy to. In this first clip, Annette talks about, really how involved she was and what she was doing prior to the pandemic.
Okay.
To the pandemic, other than the 2 days a week that I babysit for 2 of our grandsons, I was with him for 5 days a week, from right after breakfast until after dinner. I was part of his, I was hands-on part of his care every day.
And
So,
I think that that's pretty emblematic, as you said, about so many family members, is they are, despite the fact that we know that many residents do not get daily visitors, there are many that do. And so Annette is emblematic of many family members who have spent a lot of time in the facilities with their loved ones.
yeah, and I think you hit on workers in facilities were really left in an impossible position. Some argue they were in impossible positions prior to the pandemic, but oftentimes homes relied on folks like Annette. Annette was providing care that in many instances the facility should have provided, and that allowed facilities to focus on other residents that may not have that support. And when you lock the facility down on March 13th, in essence, you're losing a lot of your staff, your unpaid staff, who's really going to give the highest quality of care because love is involved. And Annette, we'll hear more from her, but she's just seen a precipitous decline in her husband really since facilities have been locked down, which is foreseeable and troubling.
Right. So let's go through some of the, because we're going to hear more from Annette from your conversation with her as we talk. And so we've mentioned several of the things that we've heard from the family members and what their findings were along the way. So coming back again, let's talk about some of the physical decline that we've heard from family members. So weight loss was one, significant amounts of weight loss. And frankly, some of the things that you talked about with respect to lost dentures, for example, or not getting proper mouth care, certainly is another factor that would impact a person's ability to eat, in addition to maybe not getting the support they need.
Sure. I mean, in addition to the the loss of weight and the pressure sores, you're seeing instances of skin being degraded, and back pain and loss of ability to use hands, even to operate a remote to watch TV. And as you said, one of the questions we did ask as well that I think intertwines is, were you missing personal objects? And almost half of the family members responded yes, such as dentures and hearing aids. So when you don't have your dentures and you don't have your hearing aids and you don't have the tools necessary just to survive, or your glasses, it's going to affect your whole quality of life. It's going to
Mhm.
obviously affect your ability to eat, but it's also really going to affect your mood. I mean, imagine these folks, very dehumanizing not to have your nails cut or your hair washed, or not to have your clothes changed or your room cleaned. And I think that goes part and parcel with really what we heard from the physical decline, and just how folks in these months just lost any progress they had made, and just really acutely suffered decline.
Right. And if the staff aren't able to go in and help help feed people who need assistance with eating, if they're not going in and turning them on a regular basis, that can lead to the pressure ulcers that you talked about. If they're not getting the therapy that they need, that can lead to the contractures that we were hearing about from people. So I know you had queued up a clip from Annette about some of the physical things that she saw when she went back in. Could you
Let's
share
let's
that?
let's hear from Annette again.
Obviously in distress. Can you imagine a 44-pound weight loss on a grown man? He was 218 when I left there in March, and he's now 174 pounds.
That's tremendous.
Yeah, I mean that only way to describe that is just devastating. And I mean, and unfortunately for Annette, she's watched it. She's had to observe her husband, um, through video conference, lose 40 pounds, and just feel helpless about it. And she can't offer any help. They won't include her in the care. And that's just really what we heard from most respondents. It's this type of physical decline, unfortunately.
hmm Well, and I think that when we've heard about the significant weight loss, and some of the other effects that people have been experiencing. I mean, certainly, we know that there were issues, and that some people were not getting the support they needed to eat. But we also were hearing that some people, as you had mentioned before, were very depressed and had lost the will to live, and also were not wanting to eat the way they were before. They really had given up, and so I think the mental impact has been just as strong as the physical decline that people have been seeing. So can you talk a little bit about a little bit more about what we were hearing about some of the mental impact and the psychosocial impact on people?
Certainly. I think, the overall response that we got was people, say, with pre-existing conditions such as dementia or Alzheimer's, who the symptoms they were experiencing were just exacerbated. And what we found was is that family members were really so important in essential to helping individuals with these types of pre-existing conditions to maintain stability. And going in every day and seeing your loved one helps them uh, orient themselves to where they are. And then suddenly this is all removed, and there's no one coming in. You're left alone. And what you find is what we saw with those folks is that they stopped to eat because they needed assistance eating. And the way they ate was in a certain routine that the family members had adopted. So with that came not only your families are reunited with folks who don't recognize them, but are also to say, I want to die.
Mm,
This is no way to live. I mean, why am I in prison? Um, and that just really shows how devastating this isolation has been,
mhm.
and how confusing and really terrible the effects have been on a lot of these residents.
Mhm. Absolutely. The residents that were cognitively aware of what was happening around them, I mean, they had their own fears about getting
Mm,
COVID, about getting sick, about the people taking care of them. And we did hear from many of them that they
yeah,
felt like they were in prison. That was a common theme, or has been a common theme, that we've been hearing from the residents that we've been talking to directly throughout this whole time frame. But for those who may have different levels of cognitive impairment, they also suffered in different ways because they didn't always understand why their family
right.
members weren't coming. And this is something I know Annette is going to be talking about in one of the clips that you have as
Yeah,
well, right, Sam?
yes, right. This is one of the more devastating clips when she describes really the impact it had on her husband, and I'll bring it up.
Hmm.
At one point, he told one of the recreation staff during our chat, "Oh, don't pay attention. She divorced me. She's married to someone else now." It's um, he's so confused, and that's so hurtful to me to think that my husband thinks I abandoned him. It couldn't be further from the truth. You know, my husband is one of 5 siblings, and at the end, his mother was in a nursing home, and he went to see her every single week at all the years she was in. This is not a man that anybody would just abandon. He never abandoned anyone in his family, and I could never abandon him.
That's devastating. I mean,
Mm,
not only you can hear the pain in her voice, but you can imagine the pain that her husband has been feeling, not
mm.
understanding why she wasn't there for him.
Right. And that's his reality. His reality is that he's been locked in a room for months without really anyone telling him, and has not seen his wife, who was married to for 45 years. I mean, one thing Annette kept saying is like, this is not how we imagined our lives would be. You know, this is not how they imagined their retirement would be. And uh, trying to place yourself in that position, it's hard. But when you see Annette's face, I mean, imagine not being able to care for your loved one or your son or your mother, and thinking, knowing that they think you've abandoned them, and
Mhm.
just the effect emotionally on both parties is just really incomprehensible and uh, hard to even describe.
Yeah, absolutely. Very difficult. And, because of because of the isolation, all residents, both those that have their cognitions and those who have some cognitive impairments, we saw across the board people withdrawing into themselves, becoming more withdrawn, more secluded, giving up the will to live, because they were so isolated and needed the supports of their family members.
Yeah, I mean, imagine how you would do if you were in a room, locked in a room by yourself. Your hearing aids are lost, your eyeglasses are lost, so you can't see, you can't hear, you can't distract yourself with television. You just sit there all day. I mean, you could see why they would call it prison,
Yeah.
and you could see why these negative physical, how it's going to be a holistic just decline. Why would you continue to function if you can't even leave your room, if you can't be with
Mhm.
your loved ones? So it's been hidden from us. I mean, we know about it because we do this every day, and family members know about it, but it's been hidden from the public. These folks have been locked away and suffering. Um, and it's only now that we're hearing that they're being reunited that we're really hearing just how awful and as I kept saying over and over again, devastating
Mhm.
this whole lockdown has been.
Yeah, it's, I mean, we tried so hard, I think, to protect the residents from COVID, and that's what the lockdown was intended to do, was to
Sure,
try to protect them from the spread of the virus and the disease, because what we know is that not only was it spreading very quickly through nursing homes, but it's very deadly for this population.
sure,
We, at this point when we're recording this podcast, more than 170,000 residents and staff members have died from COVID. It's just been devastating. But I think no one really recognized the devastating effects that the isolation was going to have
sure, sure.
on on the residents themselves. And frankly, no one thought that we'd be in this situation a year later. Who thought that I mean, I think when the lockdown initially happened, maybe we thought it would be for a couple weeks and life would be back to normal. But here we are a year later.
And and we've seen studies now from various places that show that facilities who had better staffing perform better.
Right.
And that's directly connected to the visitation ban as well.
That's right.
If we had safely allowed families to come in and supplement that care, you would only think that some of these outcomes would have been better, because when facilities are short-staffed, you just can't provide proper care. So it's all tied together. And of course, we wanted that ban initially. But as time went on, the question is, which has been more, which is going to be more harmful now after a year of this.
Right. Absolutely. One of the medical directors that we've talked to recently had told me in a conversation that he's had more of his patients die from isolation and the effects of that than from COVID directly, which I think just again shows how devastating it can be. And I know a study that a news report that we had recently seen, and this was when last year in the summer, September sometime, showed there were in excess of 40 plus
40
thousand deaths.
40,000, yeah.
Right.
And that was in November. And one thing I have done, and I showed to you, is looking at the data from the CMS and CDC and plotting the death rates from COVID and not from COVID. And they both rise together. So what that means is when people are dying in a large amount from COVID, they're also dying from other reasons as well.
Right.
And what that kind of tells you is that once COVID is in a facility and you don't have enough staff, it's chaos. And not only is it killing residents from COVID, it's also killing residents from neglect.
Right.
So you see them track each other. And I mean, if that doesn't call for a change and doesn't really highlight how horrible the lockdowns have been on residents and families, I'm not sure what else.
Yeah. So let's hear another clip from Annette of what she's been seeing, the impact and what the effect has been for not being able to see her husband.
Sure. I mean, one thing that Annette talked about, and I had asked her about, was how, communicating with him, because the idea that, okay, well, we have, it's the 21st century, we have electronic communication, that should be enough. But Annette here in this clip really describes how that didn't work for her, and it didn't work for her husband. Have they been offering you opportunities for electronic visitation? Say, for instance, like iPads or FaceTime?
Yes, they do, but he doesn't respond. He just stares up at the ceiling, and he'll talk to who's ever standing next to him and say, oh, that's a movie of my wife, or he doesn't understand that it's live.
Does he need assistance in operating those?
He can't operate it.
Okay.
Someone has
So
to.
there's always
He doesn't
so there's
have
always
an
someone
iPad.
there.
Yeah,
So there's always someone there listening to you.
Always.
When you're
Even in the visits, there's always someone there. My husband and I haven't had 5 minutes to have a private conversation in 11 months.
Yeah, I mean, that's that's so hard to when you're trying to have that conversation the way we are right now. I mean, we're in different locations and have this conversation, but and it worked for many residents. I mean, let's acknowledge the fact that it did work for many residents, having the televisitation where they were talking over using tablets, using electronic means, but for many, many people, particularly residents with dementia, it has not worked. And
Right.
it frankly is no substitute for in-person visits for those who need them.
Right. How can she, I mean, what really struck me about that was at the end, she hasn't had 5 minutes alone with him. How can they be genuine with each other? How can she ask him how they're treating him with someone there, fearing that there could be repercussions for that? I mean, prior to the pandemic, the best advocates were family members. They're going in every day and they're seeing how folks are and they're saying, hey, you can't treat my loved one this way. But
Right.
now there's not that opportunity for intimacy, for privacy, and it really, the moments you do have are degraded and they're superficial, and as Annette said, confusing. What we often heard was, I mean, we heard devastating stories about staff using their phone to call loved ones and say, your husband's dying. Do you want to say something to him? And using their own phone, right?
Right.
And sometimes it would be a false alarm,
Right.
and they have to go through it over and over again. And I mean, I don't think people understand how awful that is and how common it was. Certainly, to help some folks, but it didn't work for a lot of people. And if the largest population of folks it's not going to work for are people with cognitive problems.
Right.
And where are you going to find those folks? Nursing homes. So
That's right. Absolutely. Absolutely. Let's hear another clip from Annette, where she talked about, again, the effect for her and her husband on not being able to
sure,
be there.
sure.
And we all try to support each other, but I'm watching my husband die a little bit every day, and he doesn't even know that. And if something happens to him, I'll never be able to recover from the fact that he thinks I've abandoned him. And I feel like he's slipping away a little bit at a time every day. And can you imagine not even knowing that anybody cares about you? And you're just sitting there and they don't know why he's losing weight? Come on, really, people.
And again, these are, the story of Annette that we're highlighting today is really reflective of so many of the stories that we've heard from family members across the country about the impact that this has had on their loved ones. And the thing about it is, certainly we're a year into this pandemic, and I think we would argue that it's time to reopen safely. There are safe ways to allow family members back in to provide supports for their loved ones, and we really need to make that happen. And families want to help. They are devastated by what they're seeing from their loved ones, and they want to go back in and provide that support to them.
I talked to a woman the other day. She came out of retirement and began training so she could become a CNA just to see her mother. And she said, well, I don't know if that's a great story. And of course, coming out of retirement and training, going into a training program just so you can see your loved one,
Right.
that's not normal. And I think no one understands more how important safety is than families. They don't just want to open the doors and go in, and they want to go in and help, and they want to follow protocols, infection control protocols, and we talked about Annette with Annette, that she's offered, here's what she said about her willingness to go in and help.
Mm-hmm.
My husband has a private room. If they would let me in to be with him, it would take the stress off of them for his care. It would take the heartache off of me, and I'm sure he would start gaining weight again.
So if they said, come in tomorrow, would you be willing to wear PPE?
Absolutely. My daughter told them that she would get me a hazmat suit. Her husband is a critical care paramedic.
and he's licensed to be on helicopter rescue. She wasn't kidding. She could
Would
actually
you,
get that for me.
what about being tested? If they required you to be tested twice a week, would you do
Absolutely.
that?
I told them whatever the staff does, I would be willing to do. Just tell me what you need from me in order for me to be with him. And they say it doesn't matter. It doesn't matter if I have the vaccine. It doesn't matter if he has the vaccine. It doesn't matter what I tell them I'll do. They tell me that they don't make the rules. They are not allowed to let visitors in.
Yeah, I mean, what's really interesting, and I think doubling the frustration for folks is that they haven't seen, I mean, they've seen the devastation in nursing homes, and they said, well, what's going on now isn't working. You know, I'm willing to come in and be treated as an employee and to follow all the infection control protocols and help you, you know, I mean, it won't alleviate the total short staffing problem, but it will certainly help a little. And that's what's, and in some instances, facilities are trying to incorporate families into care, like saying, well, you have to take him, can you take him to these appointments? Or you have to take him out to this appointment, but at the same time saying, well, you can't come in. Right. So it's confusing, you know, and it's confusing. These policies are conflicting and it's frustrating because they want to care and they want to care. I mean, Annette has spent thousands of dollars trying to renovate her home to be able to let her husband come in. I mean, she's invested thousands into taking out of her retirement, and she's just not at that spot. He can't come home without assistance. Right. And so they want to go in and provide this care. It's frustrating for them. And I think it goes to what you're saying about, you know, needing to reconsider this ban and involve families in care.
Absolutely. I mean, I think that, you know, if we, there should be protocols that are put into place. And frankly, there is a process for that. I mean, even the guidance that exists today, there is a process for that to allow people in with protective protocols that include screening before they even enter the facility. And with the availability of testing right now and rapid tests, people can be tested as they get on site. They'll have the results in 15 minutes and they'll know their COVID status with proper hand washing and sanitizing, with the wearing of masks, with social distancing, with proper screening there and proper protocols. There are ways to safely allow family members back in, and that's where we need to get to. And that's what we have been advocating for with other partner groups around the country. So as we're talking, you know, now we're about a year out from the ban, and we've put out a call to action to CMS, the Centers for Medicare and Medicaid Services, to reevaluate their guidance and to effectively allow family members back in a safe way to provide supports. And so we have several different activities coming up over the next week that we're working on. We have a petition out right now that we're encouraging people to sign. Can you tell people a little bit about that?
Sure, we created a petition and you can get to it on our website. It's a petition that will be going to the heads of CMS, to every member of Congress, and probably to others, just laying out how devastating the impact has been on residents, and calling for a safe reopening of facilities so families can go in and provide care and support, or just support their loved ones.
Absolutely. We're hoping to get to 25,000 signatures. We're
at 15,000 now.
We're at more than 15,000. So we hope that listeners will share information about that. And our website is www.theconsumervoice.org, where you can get information about things that we're talking about today, and also get a link to the petition that you can sign. We've also created a set of recommendations to CMS where we offer suggestions for how they can safely reopen. That includes not only doing proper screening, putting protocols in place, but allowing every resident to designate an essential care person to be with them to provide additional supports. And so we are promoting that. And next week on March 12th at noon Eastern time, we are hosting a rally to where we are calling publicly to reopen nursing home doors in a safe and measurable way to allow family members to provide supports to their loved ones. So there are a number of things coming over this next week from the Consumer Voice.
Yeah, that's great. I just want to point one thing out. I mean, if you look at the numbers now of cases and deaths from COVID in facilities, it's steep decline, precipitous drop, and that's a lot to do with vaccine. But each day that goes down, the risk of harm from isolation goes up, and it's probably surpassed now significantly, maybe even who knows how long ago, the risk from harm from isolation. So we have to have that, that total re-examination to address the real harm now that is going to be isolation.
Absolutely. Absolutely. And not only, is a year too long for family members to be separated, but the vaccines that have been put into place and the majority of nursing home residents have been vaccinated at this point already. They were in the first priority list in states. That really has been a game changer, as you've mentioned, in terms of the spread of the virus and the protection of the residents from COVID. It's not the end all and be all. It's not the only answer. So we still have to encourage the protections be put into place, wearing masks and still following infection control protocols, even for people who have been vaccinated, whether, for both parties, family members and residents who've been vaccinated. But it has been an important step forward in terms of, I think, being time to reconsider what visitation looks like in long-term care facilities. Yeah. So go to our website at www.theconsumervoice.org for more information about the things that we're talking about today. You can find the report on our website, the signing up for the petition on the website, and information about registering for the virtual rally on Friday, March 12th. You can get more information there as well. I think we're going to close with a clip from Annette. Is that right, Sam?
Yeah, Annette's going to share just a story of what recently happened to her, and I think really summarizes and, as I said earlier, encapsulates really what's going on for family members. And I think letting her have the last word is also letting families have the last word and residents have the last word, and really where we are in this issue. So here's more from Annette.
And they just recently sent home his wedding ring because he lost so much weight. It was falling off his finger and he was playing with it and they were afraid it would get lost. So he doesn't even have that. He always holds his wedding ring when he's sitting in his chair. I think it's his connection to me. Now even that's gone. He doesn't have it on his finger anymore. And I'm sure if you lost 44 pounds, your fingers would be so thin. I just see him slipping away from me, and I'm terrified that I'm.
Well, that is devastating, again, to see the effect on Annette, the effect on her husband, and so many residents and family members have been experiencing this across the country. So thanks for joining the podcast today, Sam, and for talking about this. I think it's definitely been an important topic, and we want families to know that there are things that they can do to continue to raise awareness about this issue, to contact their legislators. That's part of what we are going to be asking people to do during the rally, the virtual rally that we hold on March 12th. So go to our website again at www.theconsumervoice.org for more information and for some action steps on what you can do to advocate for reopening nursing homes in a safe way. So thanks so much for joining us today. Thanks, Sam.
Thanks.